Hi, I'm Dr. Rajdeep. I'm a dermatologist and dermatosurgeon practicing at Charma, a skin, hair and nail clinic attached to Chirag Hospital in JP Nagar, Bangalore. One of the most important drugs used in the treatment of balding is called as Minoxidil. So most patients who come to me with balding are afraid to use Minoxidil for some reason. They have read something about Minoxidil or they have confused the side effects of Minoxidil with finasteride, which is another medicine which blocks the hormones. So let us put these fears to rest once and for all. Minoxidil was introduced about 50 years ago as an antihypertensive drug, a drug which is used to reduce blood pressure, but it was not a very effective drug to reduce blood pressure and had to be used in combination with other blood pressure reducing drugs and diuretics, etc. But they noticed that it had a very irritating side effect, that is increase in hair growth. So most of the women would find this unacceptable, so it became unpopular as a treatment for hypertension, and we have much safer medicines. So Minoxidil was associated with certain serious cardiac adverse effects, so therefore it was discontinued as a primary treatment for hypertension or blood pressure. These days Minoxidil is very commonly used in a lotion form to treat baldness. It's applied on the area to be treated once or twice a day depending on the requirement. The doctor will suggest that depending on your grade, depending on male or female, etc. There are different concentrations of Minoxidil available in the lotion form. There is 2%, 5%, 10%. There are preparations which have 12.5, 15, all sorts of preparations are there. But recommendations exist only for 2% and 5%. Though off-label, we do use 10% for patients who are not responding very well to 5%. So most of the patients respond well to Minoxidil. Minoxidil's active form is minoxidil sulfate, and those who have a defect in the enzyme which converts this minoxidil to minoxidil sulfate, they are the only people who don't respond to Minoxidil. This is a very small percentage of people. Less than 0.1% of the people have deficiency of this enzyme. So if you are on treatment with Minoxidil for more than 3 months and see no improvement at all, then you are probably one of the people who has a deficiency of this enzyme. So Minoxidil treatment is safe in most of the people. So most of the people who come to a dermatologist for treatment of hair loss are not cardiac patients. They are young people who want to get married and who want to have a good head of hair. So in these patients, Minoxidil does not cause any side effects. People who are older, who have hypertension or cardiac issues, Minoxidil is never used. Even though there is a small chance that it might get absorbed systemically and cause cardiac problems, the side effect poses a lot of risk. So even that small chance is not taken, and we don't use Minoxidil in such patients. So the doctor will assess your risk level before prescribing you Minoxidil. Make sure you meet a qualified dermatologist who understands that medicines can have side effects. You should be able to discuss the side effects with your doctor, and do not confuse it with finasteride, which is another medicine given for Andogenetic Alopecia, which has reports of reducing your sexual drive, reducing libido, because it blocks an enzyme called 5-alpha reductase. 5-alpha reductase is enzyme which is responsible for conversion of testosterone to dihydrotestostrone or DHT. DHT is the active form of testosterone which is used in the peripheral tissues like the skin. So DHT is responsible for baldness. Usually finasteride tablets as well do not cause side effects in a majority of people. However, those who notice that they are having less interest in sexual activity, are becoming depressed. So these are the people who are developing finasteride syndrome, and finasteride should be stopped immediately in these patients. However, these days we have topical finasteride or finasteride available as lotions, which has much lesser side effects compared to finasteride tablets. So whatever side effects are there with medicines which you might have read online, don't think that everything is going to happen to you. There are percentages. There are other disease conditions which can affect and cause these side effects. There is age. There are multiple factors. And please discuss with your doctor. You should be able to discuss with your doctor. If you feel uncomfortable that doctor has not explained properly to you, take a second opinion from another doctor and discuss these problems. But don't have unfounded fears that these medicines are going to cause side effects, or that you come with a mindset that doctor, I want anything other than Minoxidil. So let the doctor discuss with you and both of you take a decision as to what is the treatment you want to go ahead with.